Thank you.
Thank you, Michelle. Thank you. Yes, thank you so much for the opportunity for us to share a little bit about what our program is. We've done some really exciting, innovative things just in the last 2 years. So we are very excited for this opportunity, and we'll have some questions afterward. We're going to go over some of our general information, embedded programs, and really some resources and helpful tips. And I think, right, 3-part program right here. So we're going to look at the crisis services overview. So Waukesha County has a number of departments, and one of those departments is Health and Human Services. And our crisis program is based out of that department. So we'll talk about what that is in general terms. We'll actually go over some mental health statistics as well, and then talk about our crisis and law enforcement collaborations that we have, and like I said, those helpful tips and resources. So we're going to get things started with a little quiz. So first question here, 1 in blank adults experience symptoms of mental illness each year. Just
5,
shout it out.
4,
3,
2,
10.
1. 7. The answer is 5. Yes,
Yeah.
so 20%. So if you think of people in this room, statistically speaking, that means that one of us would experience a symptom of mental illness. Next question, 1 in blank adults experience a serious mental illness each year.
10.
2,
I would say
25.
So for that we have 20. So what is a serious mental illness? So that would be a mental illness that is so significant that it would impair someone's daily functioning. So it could be a severe depression, it could be a psychotic disorder like schizophrenia, bipolar, other types of mood disorders. Next question, blank percentage of youth 6 to 17 years experience a mental health disorder.
60.
Okay.
Say all of them.
100? 100%?
Teenagers, yes.
Yes.
Raising a few kids, yeah.
Right? So this is 17%. So probably, yeah, a little bit lower than maybe what we thought, especially since we're hearing a lot more of that youth struggling as they've gone through the era of the pandemic. So these statistics were provided by NAMI.org. I do agree with you that the youth one likely is a little bit higher. And really this is countrywide, nationwide data. I know that NAMI is an excellent organization that's always looking for more things to monitor, and they're definitely a solid source of information for us as we inform our programs and use their helpful data. So the last question here, what percentage of law enforcement calls for service are related to a person with a mental illness?
20.
25%.
So I agree with you. The statistics that I found, 10 to 15. Now based on what national source you look at, it could be 1%, it could be 40%. I have a feeling that if we ask any law enforcement officer in our county, city of Waukesha, they are going to say 60%, 70%, because it is that prevalent. So the question I have for the group now is, why is law enforcement typically that first responder in mental health calls? Why would the police interact with a person with a mental illness? Sometimes in danger.
Because nobody else will.
Because nobody else responds. Yeah, all of those are accurate reasons that we see on our end is why the police are the ones who are responding to a mental health crisis. Here are a couple of calls for service as they're coded in their CAD system that are very common every day. These are happening in our community. Welfare check. I haven't seen my uncle in a week. He stopped responding to text messages, he's getting more depressed, he told me that he's continuing to drink or he's drinking more than usual. Police, can you do a welfare check on him? Can you knock on his door? Very common. Suspicious activity. So this could be a person in the community who's calling, maybe they're pushing their groceries outside of Woodman's and they're saying that, there's a person that's standing here in the parking lot. They are just not acting right. Someone needs to go check on that person to see if they're okay. Trespassing, loitering. Someone has been standing outside the sidewalk in front of my business for hours in the rain. They're sitting there, no purpose. They aren't interacting with anyone. They just look a little bit strange. That is a call, as of today, that is a call to the police. Emergency response. My 14-year-old daughter just overdosed on pills. I think we can recognize how that would be a call to 911. Clearly you're going to get an EMS or a paramedic responding to that in addition to law enforcement. And then lastly, mental health evaluation from a hospital, let's say. Person came here for voluntary treatment. Now they're saying that they want to leave. I was just at the HHS board meeting 2 days ago where we were presenting on one of our positions to hopefully get a new ordinance to expand one of our operations here, and there was a committee member that said, why would a hospital call the police? This happens very frequently, whether it's a subject who came there, maybe they are there for voluntary treatment, loved one brought them in, but maybe they don't want to check themselves in anymore. So that hospital feels like they're doing the right thing by calling in law enforcement and having that person evaluated. So why is law enforcement the person to do that, or the entity to do that? That's because of our state laws. Anyone heard of a Chapter 51 emergency? Kevin, who's worked on our inpatient unit here at the county for a long time, is very familiar with this process. So Chapter 5115, emergency detention, also known as a 72-hour hold, is that involuntary mental health hold that by the state of the state of Wisconsin law gives law enforcement the sole responsibility to effectuate that order. So here are the criteria here, 1, 2, 3 of that emergency detention. There's a lot more complex factors that go into these criteria. It's not as black and white, but just real briefly, a person has to have a mental illness and or drug dependency and or developmental disability. That's a treatable condition. Secondly, that person needs to be dangerous to self or others, to the community, to family members, at a risk that is meeting that substantial probability of harm. And then thirdly, the person has to be unable or unwilling to cooperate with voluntary treatment. So the state of Wisconsin says that law enforcement is the sole entity that effectuates these orders, which was a great move for the state of Wisconsin in 2016. Although be it in the county, it was really something that we had to adjust to, is in 2016, these holds are now approved by crisis. So this is the paperwork that's called an emergency detention form. What this law change did, it got the crisis team, which is a 24/7 unit that is operated under the county, involved in the assessment and approval of this process. So crisis cannot do an emergency detention or get someone help involuntarily without the police, and the police can't do that without our crisis team. So the mental health response system in Waukesha County, this is just a general overview of what that could look like and the different people who might be involved or the different entities. So this is non-embedded workflow. In a minute, Lauren's going to talk about our innovative models that are trying to make the system more effective, more resource conscious. So this is a non-embedded workflow, recognizing that every situation is different. We might do an assessment at a school, at a hospital, at a home, etc. Here we start with that person who is in crisis for those reasons that we talked about earlier, that list over on the end. That's a call to either 911 or non-emergency. 911 dispatches that law enforcement officer. They have that responsibility to secure the scene, make sure that everything is safe before they start doing their investigation and gathering initial information. So once they do that, they meet with the person in crisis, we'll talk to that person, gather information from collateral sources, and this really puts the onus of identifying a mental health issue on the officer. And that is what our embedded models do a better job at taking that responsibility off the police. So in general workflow here, we have that law enforcement officer and calling into our crisis team. We're exchanging that information, and then we say, yep, we're headed out, and then we meet that officer to where it is that they are. So potential outcomes of that assessment could either be voluntary or involuntary. So we absolutely work with everybody, with everyone's resources to do voluntary options when we can, whether that be a safety plan or hospitalization voluntarily. If we don't have the ability to carry out a plan, then we would be looking to approve that emergency detention. So you can see these are all the various stakeholders that could be involved just in one crisis. So when you talk about resource-intensive interventions, that is very much a reality of the mental health system. So we have the person who's in crisis, their family, collateral, 911 dispatch, law enforcement, HHS crisis responders, medical hospitals, and then of course psychiatric and mental health providers. I'll turn it over to you to talk about our crisis team.
So this is not all of the crisis team pictured, but a good portion. So our crisis team comprises of, we have 27 professionals on our team, and just really proud of the fact that we have a wide range of experience on our team. So we have individuals that are former law enforcement, veterans, that have prior experience with adult protective services or maybe child protective services. They may have previously worked on an inpatient unit, varying levels of outpatient care. We also have a peer support specialist that works with our team as well. So it's really helpful to have just this wide experience so that we can collaborate and work together to come up with the best type of strategies to help somebody that's in crisis. So our crisis team, the hub for us is based out of the Mental Health Center, and that's right here in Waukesha, just on Airport Road, which Kevin is familiar with. And we are able to be reached during business hours through that first number, and we do accept walk-ins. So that's anytime between Monday through Friday from 8 a.m. to 4:30 p.m. And then we can be reached 24/7, 365 through that second number listed. So what is the role of crisis? So Jenny explained a little bit about us responding out with law enforcement to assess for those involuntary detentions. We have really worked hard to be looking at ways that we can help an individual that's in crisis, regardless if they're maybe meeting criteria for an involuntary detention. If someone's having a crisis, we want to be able to be there on scene as quickly as possible. So we are responding out at the request of law enforcement. If it's maybe a situation that's not rising to the point where an officer is requesting us, but maybe a family is, we can look at a teamed response with maybe 2 clinicians to be responding out. We are answering our crisis line 24 hours a day, and we do get quite a few calls from family members, or maybe it's a community agency or provider that's seeking feedback on, hey, this person is having a crisis, what should I do? And we will walk that individual through some steps, some recommendations, and come up with a plan to get that person the help that they need. We also take referrals from, like I said, community agencies that will also work with us for just that initial follow-up and support. We like to do a lot of ongoing follow-up with somebody that's had a crisis. So what we will do is, after that initial crisis, we'll schedule follow-up calls. Maybe we'll go out to that person's house in a pair and meet with that individual to make sure that they're getting that level of care. We do make referrals to our opiate overdose specialist and then also our youth outreach specialist. So here's some data for our crisis team from 2023. If you see, we've had almost 9,000 calls, and each year that number seems to be growing. Down here you'll see that here's a breakdown of the ages of individuals that we've met with. So it looks like we had the most contact with individuals between the ages of 18 to 24 years old. And then the next age range would be 35 to 54 years old. So over on the right, here you'll see how many calls that our crisis team received from law enforcement overall. So it's almost 4,000 calls. And this is the breakdown of jurisdictions that we have received calls from. So within Waukesha County, there are 26 police jurisdictions that we're working with. Sometimes we do work with jurisdictions outside of Waukesha County if there's a situation that would bring that individual in crisis within our county. So you'll see here that 11% of those calls resulted in that emergency detention. So that's quite low, and that's a really good number because that means that we're working really hard to keep an individual within the community in a least restrictive means and able to get that person connected with community services, or maybe they're going voluntarily to inpatient treatment.
And I would just add that this number, 432 emergency detentions, so that is with crisis coming on scene, working with that person, hopefully not to do that emergency detention. Prior to 2016, when the law changed in, say, 2011, the county did 1,100 emergency detentions. So if you think about that person who, who hasn't made a comment that I could just drive my car into a tree, I could just jump off the bridge right now. Law enforcement in their investigative capacity was very black and white, and they will tell you that that's how they're trained to approach a situation. If they're investigating a crime, if they have evidence a crime has been committed, they have a victim, they have all of these things, that's going to lead to an arrest. Well, if the person made the comment, if they made that statement, we have to take you in. That's very much how that mentality was. So when you think of children as young as 8 years old to all the way up the lifespan, there was a lot of people who were being unnecessarily detained because you were having a law enforcement officer make that decision on their own without the support of a mental health worker on site.
So we were really seeing that there is a strong need for a community member that's having a mental health crisis to get that mental health response. Is it really best for an individual having that crisis to have a police response versus a mental health professional? So we definitely were seeing that law enforcement is spending a great deal of time on mental health related calls. We were also seeing a need to have a faster response for those mental health clinicians to get out on scene. And we worked really hard to look at our workflows and ways that we can embed mental health workers in police departments and the dispatch center to speed up that response. We are also seeing a need for looking at ways that we can identify an individual that's having a mental health crisis that's coming into the emergency response systems. That may be frequent contact with police. They're calling into 911 very frequently or going to the emergency department. And also taking a look at, hey, how can we identify somebody that's getting frequent legal charges? Maybe they're going in and out of the jail system, and that's not the best place for them. It might be because they're having symptoms of psychosis and not getting that treatment that they really need.
So in the embedded workflow now, these are those same steps we showed you just a couple of minutes ago. So you're going to click the slide. We're going to remove those last couple of steps. Click it again. And what these embedded workers do is they get involved at that point of contact. So they are the ones who are helping to identify calls for service that are related to mental health. They get information more directly and more efficiently rather than putting it on the officer to figure out their initial information. Yep, this sounds like a mental health issue. I'm going to call someone to help with this. So it takes away those unnecessary steps or those steps that are in the process now and gets us involved much more quickly. In fact, that we are, as soon as they're clearing the scene in terms of safety, that's when we are arriving in our embedded positions.
Okay, so here's a little roadmap of our embedded positions. So it all started back in November of 2021, and I'm excited to say that I was the first embedded clinician within the Sheriff's Department. So packed up my box from HHS and moved over to actually a little cubicle in the Detective Bureau. So it was definitely, interesting to be, right in the environment with detectives, with the deputies, the patrol supervisors. But it was a really great opportunity for us to build that trust and collaboration with one of the jurisdictions that we're working most frequently with. It was a great starting point for us to really be able to start our embedded pathway. Because that pilot program was so successful, we were able to look into adding a second position. And a big part of that was our crisis team. So Health and Human Services received American Rescue Plan Act funding to start off some 3 additional programs. And then in February 2023, we were able to launch a co-responder. So it's the crisis response unit within the City of Waukesha Police Department. And then in spring of 2023, we were able to embed an HHS crisis counselor within the dispatch center. In April of 2024, so this month, we were able to get funding for an approval for a second shift crisis clinician within the City of Waukesha PD. And then another very exciting opportunity is that we will be having an embedded crisis clinician with the City of Brookfield Police Department. So that's going to be another great opportunity for us to reach more of the county in that embedded setting. And lastly, I just wanted to touch on the fact that our Health and Human Services leadership and within the crisis team, we're constantly looking at data and trends and ways that we can better support the community. So I'm excited to see where things will continue to grow. Okay, so here are our embedded mental health professionals. So you'll see Maddie Savick and Kristen Bauman. So they are currently the full-time clinicians within the Sheriff's Department. So their hours are Monday through Friday from 8 a.m. until 10:45 p.m. So in order to get within the Sheriff's Department, these clinicians have had to go through our DHS 34 crisis training. So that way we are in compliance with the state requirements, and it's a pretty intensive type of training. They are also had to go through an extensive background check to get that badge access, access to the 911 system, it's called NetViewer, and then also to the police system called Spillman. So they have access to all of these different systems to help better inform our response. And they're also working very closely with our crisis team and then the Health and Human Services Clinical Services Division. So it's been really helpful for these embedded workers to be able to see the records from Health and Human Services if there's been prior contacts and just better help support our response. So some of the data from last year, we have had 550 calls for service within this program. So that's quite a bit. They're definitely busy, and some days they're going from call to call. In addition to the 550 calls, they're frequently doing follow-ups. So a good example of this is we had contact with an individual early this year, and initially that person was not wanting to seek treatment, just not at that place of being ready for support and getting that connection. And with Maddie frequently going out to that individual's home, meeting with them and their family, we found out this week that they're actually enrolled in counseling and starting to get that help that was needed. So that's really great to see. Their response time can be as quickly as 10 minutes, and they're traveling separately from deputies. So this is a little bit different than the City of Waukesha program. So they are responding in a Sheriff's Department Tahoe separately from the deputies. And this is very helpful because Waukesha County is large, and if they have a call from one side of the county to the other, they can quickly meet separate deputies that are out on the road. This also gives them the opportunity to, if they're responding to a call and they're saying, hey, deputy, I think I have this under control, we can create a safe plan with family, those deputies can get back out on the road and leave the scene. And that happens about 40% of the time. So what is a typical day like for them? So what happens when you're arriving into the Sheriff's Department? You're calling into the police radio, so you actually have access to that radio. You have a CAD number calling in. You have to get a little bit familiar with what the police codes are, so that's definitely been fun for our team to learn a little bit more about. Logging into those multiple systems. And then taking a look at what type of activity there's been in the county the last 24 hours. So that would be looking at updates from the Sheriff's Department, updates from our crisis team, and seeing if there's any situations that may come back or areas for follow-up. At that point, then you're just going to be waiting for activity in the community. So they're scanning that net viewer system, listening on the radio, and if they hear a mental health or substance use related call, that's when your ears are going to perk up and either self-dispatch, so call into the radio and start to get out on scene, or maybe the deputy's on another call and they will request that the mental health professionals respond out. And at that point, when they're out on scene, that's when they would decide, hey, is this something that deputies should stay or should we relieve them? Another additional thing that they're working on is attending those roll calls so that they can build relationships with deputies, they can provide mental health updates, and they'll go from the different substations within the county to do that. And then at the end of the day, they're logging off and signing off on that police radio. So here we have our City of Waukesha Crisis Response Unit. So right at the top we have Anna Diaz and then Officer Sunny Schneider. So these clinicians within City of Waukesha PD, that model is co-response. So they are riding with that officer to the situation. So where that can be helpful is that they are getting out on scene as quickly as possible with that officer. And it's helpful in City of Waukesha just with the condensed area. A good example of that would be, let's say that a call comes in through 911. We have an individual that's maybe acting disorderly in the street, and Anna's riding with the police officer. She can look at our system and say, hey, oh, that person may have missed their last 5 mental health appointments. We're familiar with him, and be able to provide that immediate support and de-escalation. And maybe this is a time that they're able to get that individual back home versus maybe a disorderly conduct charge. So the hours of the program are Monday through Friday from 10 a.m. to 6 p.m. So Anna also has access to the police radio, and she is wearing a protective vest because she's riding in that car. They are working very closely with Waukesha Memorial Hospital so that they can provide best practices in client care and look at situations that, hey, maybe this could be figured out with our crisis team before police are being called out. So City of Waukesha PD and the Crisis Response Unit are having regular contact with the hospital to work on those things. They're doing frequent community engagement and education. Some of their service for calls in 2023, it looks like it was 383. So they are very busy as well.
Mm-hmm. Can I ask who has heard of this unit? Has anyone heard of the Crisis Response Unit already? Okay. It's gotten a lot of great publicity. The picture down at the bottom there is Chief Thompson, that's Officer Fink, and then our other crisis supervisor, Mariam Fatirion. This was a highlight of the mayor's breakfast last August. And I'll say it's because of great PR opportunities like that we have been expanding. You've seen that roadmap. I happen to know that the City of Brookfield mayor was at that breakfast, and that was at the time where we were talking to the Brookfield Police Department. If you were taking note, if you could see all those different graphs, Brookfield was that top third law enforcement agency that works with us right now. So it was a great opportunity, and so we're just really grateful to get this information out to the community level.
Okay, and lastly for embedded. So like I mentioned earlier, we now have a crisis counselor. It's actually 2 crisis counselors that are sharing that role within the 911 dispatch center. So what the roles and responsibilities are for the crisis counselors is that they are joining those first party and second party suicidal calls, or maybe it's a well-being check. And so the dispatcher within the comm center, they are owning that call. So the dispatcher is still that main call taker, and then the dispatcher will, what they call, barge in the crisis counselor. So at that point, the crisis counselor can provide some immediate support. They can speak with that caller for a well-being check and maybe get some additional information that the dispatcher might not have known. So it's really helpful when we can look at our systems and maybe we're familiar with that caller and help that person more immediately. They're also looking at all of the calls for service and taking a look at, hey, is this a situation that our crisis team should be alerted on? So we've been really working hard with the police jurisdictions to call the crisis team if it is mental health or substance use related, but that doesn't always happen, and this is a way for us to be more proactive in that. So if we see that, an individual that we've been getting calls on from maybe family or providers is having a situation in Pewaukee or Oconomowoc and they're having police contact, we can reach out to that officer and ask that they connect with our crisis team. And our crisis team over at Mental Health Center can start to get packed up and ready to meet that officer out on scene. So it's a really great way for us to look at how can we help this person that's in crisis and maybe avoid criminal charges or further contact within the next few days. They're also taking a look at data and trends that are happening within the community. If they're noticing that there's a certain facility that's having more contact with the crisis team or police, they're taking a look at those types of things. So another area that we have seen a major need for improvement is our emergency detention process and the time that is spent for law enforcement on those types of calls. So like Jenny mentioned, when somebody is placed on an emergency detention, they are involuntarily going to the hospital, and behind the scenes that can cause a lot of time for that individual being at the hospital. So they could be getting that medical clearance treatment, and it could take anywhere from a few hours to longer, and then it's still some time for them to get admitted to that psychiatric unit. So what we're doing is having that crisis clinician call the ER, call the hospitals, and find out what the time frame is, and are there ways that we can better look at how to improve that.
So when Lauren says a lot of times, she's absolutely right. We've actually just started to do a data time tracking process on these emergency detentions. So those boxes that we all showed, that kind of general workflow, what we are seeing is that takes an average of 10 hours of time. 10 hours from the time that that officer first makes contact with that person, with the crisis assessment, with approval, the medical clearance. Someone has to go to a hospital to get medically cleared before they go to a psychiatric room. And that's where then the law enforcement officer kind of releases that person to the custody of the psychiatric unit. That is 10 hours for a non-complicated emergency detention. So there's no ingestion, there's no injury, there's no UTI or other complicated medical issue. That's 10 hours of time. And that's definitely something that we know needs to get better, mostly for that person in crisis, because what we have seen is that person who's having symptoms of paranoia or mood irregularity, they're getting more amped up. They're in an emergency room, it's busy, it's loud, they got officers standing right next to them, maybe they're handcuffed to a bed. Like, that's just not how a person who's having a mental health crisis should be treated. So if you or someone you know is struggling with mental health, the message that we want you to take away today is just please reach out. Our crisis program is available 24/7. We have a couple of items here that you're welcome to take, so you always have our number. So like Lauren said, we have a call line. We can go mobile 24/7. So what you can expect if you do call our line, we are going to gather information. It's possible that we could do a risk assessment if we determine that there's some type of immediate need to assess for. We can also discuss voluntary and involuntary interventions, so we can take calls from anyone in the community. We can take calls directly from people who are looking for assistance themselves, but also family members, friends, etc., really anybody. And if the person that you're calling about is not in Waukesha County, we can still help with either connecting you with another crisis program. In the state of Wisconsin, crisis services are actually mandated. So 988, who's heard of 988? couple of people. So that is the National Suicide Prevention Lifeline. So there's federal legislation that came out 2021 that they wanted a 3-digit number similar to 911, similar to 511, 211. That was a easy to remember number to get connected to the National Suicide Prevention Lifeline. So that's also a resource for you. They would provide phone support. They don't provide any type of mobile response, but they can definitely triage with emergency response if needed. Resources for persons who are supporting a loved one or a friend with mental illness. NAMI Southeast Wisconsin is an amazing resource. Used to be NAMI Waukesha, just off of, where are they, Main Street here, Broadway. That they've moved locations and they've also expanded their region. They now work with Milwaukee and Jefferson, so that is why they're rebranded Southeast Wisconsin. But they're just a very helpful nonprofit agency that can provide information, referral. It's really for that person who has a loved one with mental illness, because that can be a very powerless space. It can be a very helpless space. They have a lot of support groups for education about mental illness and really how to support a loved one who's going through a condition or going through treatment, and advocacy as well. They have a really great resource that they put out called Navigating a Mental Health Crisis. If you just Google this, you'll get this 33-page PDF document. So for loved ones, if you have someone who's struggling with a mental health condition, maybe the best time to engage with them on a plan is when they are doing well. So things that you might talk about with that person, and what this plan really guides the reader through is you might talk about warning signs. So someone might say, I know that I'm not going to be doing well if I don't sleep for 3 days, or if I have more cravings to drink, I know that I'm going to be in a stressful spot in a couple of days. When to think about going to a hospital. So again, that could be symptoms related to low appetite, it could be sleep, it could be I'm thinking about harming myself, I'm thinking that I don't want to wake up tomorrow. Those would be reasons why you might go to a hospital. When to consider calling 911, and also who could be involved and who not to be involved. You know, Aunt Betty's really helpful to me when I'm in my darkest moments. Uncle Joe is not. So just having those conversations about who you would want or who that person would want around you when you're experiencing a mental health crisis. Techniques that may de-escalate a crisis. Can't say specifically enough that keeps stimulation level low. We do see how everyone coming to the scene, everyone involved, sometimes we have to diffuse that situation because there's just too much going on, and that can add a lot of stress to the situation. So keeping your voice calm, avoid overreacting, listening to the person, expressing support, concern, avoiding continuous eye contact, ask how you can help. That stimulation factor, I think if there's going to be a top one of these, that would be my suggestion. Moving slowly, offering options instead of trying to take control, being patient, gently announcing actions before initiating them, giving them space, don't make them feel trapped, don't make any judgmental comments, don't argue or try to reason with them. And when we were talking with Michelle and Karen to prepare for this presentation, it sounded like they've had some encounters where maybe you see someone on the side of the road and you don't know, should you engage with that person, should you not? I don't want to be in that position to tell you what you should or shouldn't do, even if it's, I know there was one conversation, oh, should I just take this person in my car and drop them off somewhere? Your safety is key. If something is not feeling right to you, don't do it. Don't feel like you have to be that do-gooder that's going to put yourself at risk, maybe put that person at risk. I think if you are interested in offering that person help, keep space. Say, can I help you in some way? Can I make a phone call for you? Is there some type of help you need? But really rely on professionals like law enforcement, like your mobile responders, to help navigate that situation. So there's I don't want anyone to feel like they would need to kind of put their own safety in jeopardy if they're in that type of situation. And then lastly, helpful tips. So if you have to call the police for a mental health matter, you can inquire about the availability of a CIT trained officer. CIT training is Crisis Intervention Team training. It's based out of Memphis, where in that jurisdiction, that city, years ago they developed a 40-hour curriculum for police officers that they learn about mental health conditions, they learn de-escalation skills. So it's not the place of a clinician, a responder, like a HHS crisis responder, but they have specialized training in how to identify a mental health issue, how to work with someone who has a mental health crisis. You can provide the person's diagnosis if known. Dispatch will likely ask for a physical description. This happens a lot in our area. If we're working with someone, they leave the building, but we weren't quite sure if they were going to be safe. We have to give a physical description of what that person looks like. Provide information that could assist in de-escalating a crisis, and also what wouldn't help in a crisis situation. So the person could tell dispatch to relay this to the officer. He prefers being called Jimmy. He likes writing poems. He likes listening to music, and provide what has helped in the past. Provide information on if there is history of aggression, violence, any access to firearms. And then lastly, I'll say that unfortunately, this is the reality, but once 911 has been called and officers arrive, that caller really has no control in that situation. And I think that's something that when we hear calls on our crisis line from families, they're very much in this position of, I want to see my loved one get help, but they could feel very guilty. They could feel very torn with making a phone call to the police or to a crisis response unit for an intervention, because you really lose control once you have law enforcement on scene. Like I said, law enforcement is trained to address immediate safety. So if someone's hearing voices, they're saying, take your hands out of your pockets, take your hands out of your pockets. You can't hear that law enforcement officer. The officer is going to try to be directive and try to approach that situation as calmly as possible. But that's where we see oftentimes law enforcement and a person having a mental health crisis not coming up with that outcome, that goal of de-escalating. In fact, it kind of escalates the situation very frequently.
For comments, I want to thank you both so much, not only for the presentation, but for the work that you do.
Absolutely.
Thank you. Thank you.